Good afternoon and welcome to the state's response to COVID-19 webinar, part 6. My name is Kiami Harris, and if you've been joining us, you know that we have been highlighting the great work that has been happening across the country around state's response to COVID-19 in childcare. This week, we have joining us Washington, D.C. and New York State, who have been very responsive in their states, and you're going to hear about the work that they've been doing as they address coronavirus and pandemic. And so I'm going to introduce to you our presenters for this time. I'm going to start with Dale Brown, who is the program manager for DC Child Care Connections and brings a wealth of over 45 years of experience in the social services field to the Child Care Resource and Referral Agency. She is responsible for developing strategies, establishing partnerships, educating families, caretakers, and the community in how to support children's learning to increase their achievement, providing leadership, developing and tracking work plans, procedures, proposals, reports, and presentations. She is also instrumental in documenting key decisions, collaborating with partners, and communicating official plans and managing quality assurance and community outreach plans. We also have joining us Brenda Harris, who is the Chief Executive Officer of Kids Comprehensive Services and has over 30 years of experience in the mental health field with children and families in schools and communities. As the CEO of Kids Comprehensive Services, Ms. Harris is an early childhood mental health consultant for the Comprehensive Services team pre-kindergarten enhancement and expansion program in the District of Columbia, as well as responsible for ensuring that the DC Child Care Resource and Referral is operating with fidelity and is compliant with federal and local regulations by providing leadership and direct oversight. This includes education and career development support guidance, expert consultation, technical assistance, policy development, and access to resources related to early childhood programs. From New York, we have joining us is Meredith Chimento, and she is the Executive Director of the Early Care and Learning Council. Meredith began her career as a community education Peace Corps volunteer in the Dominican Republic, followed by many years with the YMCA. She started as a school-age child care program in her hometown through the YMCA when she realized she had no place for her children to go after school. Prior to joining the fantastic team at the Early Care and Learning Council, Meredith worked for the United Way of the Greater Capital Region, focusing on ways to change community conditions specific to the needs, education, income, and health. We also have Kathleen Halaz, who has served as the Executive Director of the Child Care Council of Westchester, Inc. since February 2003. A child care resource and referral agency, the council has been promoting safe, quality, and affordable child care as a catalyst for family self-sufficiency and well-being, school readiness, and workforce preparedness for over 50 years. The council proudly supports Westchester's child care and after-school community of 750 programs serving children birth through 12. She holds an undergraduate degree in political science and a master's in counseling psychology and an MBA. And finally, joining us from New York is Jamie Frank, who serves as the Associate Commissioner for Child Care Policy and Strategic Initiatives for the New York State Office of Child and Family Services. Before that, she served as the Assistant Secretary for Education for Governor Andrew Cuomo. She previously served in an education unit in the New York State Division of Budget. Before coming to New York State government, Ms. Frank was an English as a second language teacher at a public elementary school in North Carolina. I'm going to now turn it over to the team in Washington, D.C. to speak on their response to COVID-19.
Good afternoon, everyone. Thank you for joining us today. My name is Dale Brown. I am the project manager for DC Childcare Connections, which is the resource and referral for the Washington, D.C. Before we get started, I would like to introduce the administrators from the Office of the State Superintendent that made major contributions in moving DC forward to where we are today and where we're going tomorrow. Eva Lagari, Interim Assistant Superintendent of Early Learning and Licensing and Compliance Director. Dr. Catherine Kigera, Director of Quality Initiatives, Division of Early Learning. My co-presenter, Brenda Harris, who is the Chief Executive Officer of Kids Comprehensive Services, which is the organization that operates DC Childcare Connection. In the District of Columbia, we have 470 licensed child development facilities. 364 are child development centers and 106 are child development homes. Next slide, please. In 2018, DC developed a district-wide child care disaster response plan, which outlines each agency's role and responsibility in case of a statewide emergency. The goal of the plan is to provide Washington, D.C. with an organized response structure. It creates an intergovernmental emergency response network. It provides policies, procedures, and resources for the district that really describes the role of the OSCE's Division of Early Learning, the role they would take in response to an emergency. It includes local, regional, federal government, voluntary disaster relief organizations, private sector, and the community. And it really has this twofold. It allows for planning and coordinating a disaster response action and improving the quality of the provider's emergency plan. Next slide, please. The virus has risen to prominence in Washington, D.C. and the surrounding region in a very short time frame, in a matter of weeks, taxing healthcare infrastructure in the area and taking a severe toll on the economy. By early March, the virus had arrived in the Washington, D.C. area. Closings, shutdowns, emergency measures followed rapidly as the mayor introduced orders to reduce the transmission of the virus through social distancing and prepared the region for the pandemic's health and economic impacts, which, as you know, are many. On March the 7th, DC announced that the first COVID-19 case had arrived into DC. March the 11th, the public health emergency was declared in DC. The 13th, OSCE issued a COVID-19 guidance for childcare facilities. March 30th, the mayor issues a stay-at-home order. April 15th, the mayor extends the public health emergency order to May 15th. On May 15th, the mayor extends the public health emergency order to June 8th. Next slide, please. The Office of the State Superintendent of Education provided guidance. The child development facilities were given the option to remain open. That guidance was issued on March the 13th. It outlined the procedures for those choosing to remain open, in addition to closing procedures as well as payment processes for child care providers participating in public funding. The child care providers participating in the public funding continue to receive payment. There are weekly virtual town hall meetings led by the Office of the State Superintendent. The District of Columbia organized a Reopen DC committee with one specifically for child care. Next slide. partnering with 3 existing licensed child care providers, implemented an emergency child care initiative for healthcare workers, first responders, and government workers. There are 6 licensed sites operating Monday through Friday from 6 a.m. to 8 p.m. They serve infants, toddlers, preschool, and school-age children. They're located near medical facilities. They are operated by experienced early educators. Next slide, please. DC Child Care Connections plays an important role, a key role, in supporting children, families, providers, and the community to execute the response activities and tasks that are detailed in the Child Care Development Response Plan. During COVID-19, DC Child Care Connections responsibilities include collaborating with the Capital Quality, which is our QRIS system, DC Shared Service Alliance, Low Income Investment Fund, and other partners to provide an expanded system of support. We collaborated with our partners to design and deliver distance learning. We coordinated trauma-informed practice. We facilitated the emergency application process. We provided virtual technology assistance. We published a bi-weekly family activity newsletter that's called Family Connections. We developed a PPE supply procurement resource document. We continued to work through QRIS to provide the monthly community of practice meetings, and they went virtual. We advised families on child care placements. DC Child Care Connections work closely with EC Shares DC and local vendors to negotiate with the PPE suppliers for discounts and free memberships. That resulted in a PPE resource document that is updated regularly and shared with providers. Our call center under DC Child Care Connections has managed to date over 1,500 calls from families, providers, staff, partners, and the general public. We referred providers to the Low Income Investment Fund for financial guidance. One of the areas that we are most proud of is how quickly together we were able to turn the system from providing face-to-face supports to an all-virtual system. After Mayor Bowser issued a stay-at-home order in mid-March, we moved to convert services and supports to virtual. An example being, beginning in April, there were 27 webinars offered and over 2,000 participants registered. The consortium supported the providers in the use of technology in how to use Zoom, Google Hangout Meet, and GoToWebinar. We had cooperation among all levels. The State Office of the State Superintendent of Education, Division of Early Learning, continues to provide their full support, ensuring that we are included in conversations and kept abreast of any changes. What we'd like you to know, the CCR&Rs are recognized nationally, even by the Center for Disease Control. They issued a statement on April 21st advising child care providers to plan ahead to ensure adequate supplies to support hand hygiene behaviors and routine cleaning of objects and surfaces. They further said that if you have difficulty in obtaining these supplies, please contact your local child care resource and referral agency. They also provided the website for Child Care Aware. So the reach for child care resource and referrals is far and wide, and of course nationwide. With that said, I would like to introduce my co-presenter, Brenda Harris, who again is the Chief Executive Officer of Kids Comprehensive Services, DC Childcare Connections. Brenda?
Thank you, Dale. Next slide. Today, I'm going to talk about Reopen DC. We now have a once-in-a-generation opportunity to thoughtfully build toward a more equitable, resilient, and vibrant city. But we will need to be measured, data-driven, and deliberate to ensure a safe and sustainable return. Next slide. In line with Mayor Bowser's vision, the recommendations are anchored on DC's core values of hope, health, opportunity, prosperity, and equity. These values guided all dimensions of considerations and deliberations on Reopen DC recommendations. From collaborating with DC Health and national public health experts to work closely with residents, community groups, and business and civic leaders. These recommendations reflect our city's deep commitment to these values. We acknowledge that with reopening comes incremental risk in each stage. The HOPE framework help informs us how we reduce risk for residents as DC moves towards a new normal. Health. We value a health and safety city. In addition to ensuring our residents are healthy, this is an opportunity to prioritize the improvement of health outcomes, the development of a more responsive emergency service system, increase health in our environments. We hope a reduction in traffic fatalities, injuries, and crime. Opportunities. We value creating a chance for residents to thrive. As through recovery, we can help residents achieve their goals through supporting a vibrant job market and planning for new job opportunities through education and new training opportunities. We can support our small businesses and entrepreneurs with technical and business assistance to come back a stronger city. Prosperity. We value a vibrant city. We know that restarting our city is critical for our businesses and residents and will take shared responsibility. We will need to ensure a strong financial recovery for our government and businesses to support critical investments in our schools, in our infrastructure, our social services agencies, our child care facilities, our world-class places and spaces, and housing for our families. Equity. We value improving outcomes for our most vulnerable. We hope to build affordable housing, convenient and healthy communities, healthy food, local business development, retail options, and great community facilities. They should be found across the city in all neighborhoods, targeting resources to those communities that are in the most need. Next slide. The Reopen DC process was led by the Reopen DC Advisory Group, appointed by Mayor Bowser. The advisory group consisted of a steering committee and 11 industry and population committees. The Early Education Child Care Committee consisted of child care providers, local education agency leaders and staff, city agencies, community members, families, teachers, private sector, and community-based organizations. Next slide. With mounting economic damage, the national pressure to reopen cities is undeniably growing, but the district led by Mayor Bowser has continued to rely heavily on the advice of scientists and public health experts. Our child care recommendations for stage 1 is limited child care facilities open. Providers receive guidance developed by the Office of State Superintendent of Education in partnership with DC Health and based on CDC guidelines, guidance for child care facilities. Next slide. We will also limit 10 people per classroom, including adults and children. There'll be daily symptom screenings, staggered drop-off and pickups, and a strict dismissal criteria in the event of a positive case. Next slide. In stage 2, we'll have additional childcare providers encouraged to reopen. We'll continue to use the guidance from the Office of State Superintendent of Education, and we'll still have 10 people per classroom, including adults and children. We'll still have daily symptom screening, staggered drop-off and pickups, and strict dismissal criteria. Next slide, please. In stage 3, we hope that nearly all licensed child development facilities will reopen. We'll still have 10 people per room recommended, including adults and children. During stage 3, there'll be a potential consideration of larger rooms or group sizes. Next slide, please. We acknowledge that with reopening comes incremental risk in each stage. Reopen DC is about working together as a community in a way that is safe and sustainable. Together, we will create a plan that is based in science and tailored to the needs of all communities. We know that children are our future. While we can't protect them from going through a traumatic experience, we can help them cope and recover. Thank you. I'm going to turn this over to New York.
Hi, this is Meredith Chimeno. I'm the Executive Director at the Early Care and Learning Council. And if you could just move to the next slide, please. We are going today to first hear from Jamie Frank, followed by myself speaking a little bit about the CCR&R response, and then Kathy Hallis from Westchester County will speak. So I'm going to turn it over now to Jamie Frank to get us started. So Jamie, we can't hear you. We'll just give it a minute. Jamie, are you there? Okay, so I think what we'll do is give Jamie a minute to join us. If you could go to the next slide, please. And I think we'll give her one more second. Jamie, are you there? She cannot get unmuted. So
Jamie, I just sent you a PIN that you need to enter into your phone to be able to speak. So it just came through.
we will give Jamie a second more, and if not, we can skip ahead to my slides, and then Jamie can come back on. We'll give it one more second. The pleasures of working from home and technology. Why don't I get us started? And then, Jamie, we can circle back to you, and I think it'll be completely fine. So if you jump ahead a few slides, I'll tell you when to stop. Keep going, keep going, keep going. There we go. Well, oh, back one or two, sorry. One more. Great. So Jamie and Kathy, what we'll do is I'll get us started. We'll go back to Jamie, who can give the state overview of what's occurred, and then we'll go to Kathy Hallis, who can speak to the local level. So anyway, good afternoon. So I'm Meredith Chimeno. I'm the Executive Director of the Early Care and Learning Council. We're the statewide membership organization for the 35 child care resource and referral agencies located throughout New York State, serving 62 counties in the state. So in New York State, CCR&Rs have been on the front lines meeting the needs of communities since we began our stay-at-home order and New York's on-pause mandate beginning March 15th. School districts across the state closed, and parents quickly scrambled to find childcare for their school-aged children. Licensed and registered childcare programs also worked diligently to meet the response by either closing their doors or remaining open to meet the needs of the essential workers. The CCR&Rs immediately began to work with these districts to meet the needs of their communities. They tracked data through phone calls and surveys, identifying program openings, parent need, and staff availability. The Early Care and Learning Council, funded by the CARES Act in partnership with the New York State Office for Children and Family Services and our network of 35 CCR&Rs, launched the CARE Scholarship Fund to provide free child care for all essential workers earning 300% of poverty or less throughout New York State. $20 million was allocated to fund this scholarship program beginning April 20th, which is currently running through May 31st. $8 million of the CARES Act funding was provided to the CCR&Rs to purchase supplies for open and operating providers. At this time, we've received over 8,400 parent applications and 4,600 applications from providers. The Early Care and Learning Council created a series of social media posts, some of which you see in front of you, in addition to communication to employers utilizing networks such as the Society for Human Resource Management, local and statewide chambers of commerce to promote this program to employers. The governor announced the scholarship program on April 23rd, and the CCR&Rs immediately began work to diligently promote this program. Next slide, please. Parents who applied for the program were asked to provide a letter from their employer stating that they were an essential worker as designated by Governor Cuomo's executive order, and that they were required to work outside of the home. Parents filled out an online application. As you can see in front of you, the applications were created in English, Spanish, and Chinese using Google Docs. We made the surveys accessible so that they can be completed from a smartphone, trying to reach as many families as possible. Parents were asked to attest that they earn less than 300% of poverty. The completed applications are made accessible in real time to the 35 CCR&Rs through an Excel document. Applications are sorted by county, and the corresponding CCR&R will reach out to a parent to confirm eligibility, determine if they need assistance finding care for their child or children, or if they're currently enrolled in a program. Next slide, please. We're using Google Data Studio to analyze the data regarding applications received. Here you can see a count of over 8,000 parent applications submitted in English, coming primarily from the southern part of New York State, the 5 boroughs and 2 counties in Long Island. The majority of the respondents are healthcare workers with 1 child in need of care. Next slide, please. Child care providers and early educators were asked to complete an online application, which also was provided in English, Spanish, and Chinese. We call their application a PIP. Providers were asked if they were currently open, whether they had enough supplies on hand to care for children, over the course of 2 weeks and to identify what supplies they needed to care for children. Parents were then matched with a provider application. Each week, providers throughout New York State submit a roster of children in their care to CCR&Rs for payment. The payment is made directly to the provider by the CCR&R up to the market rate of care in their provider's specific area. Next slide, please. Again, we use Google Data Studio to look at the provider's profile, paying attention to program modality, number of full-time staff and part-time staff, in addition to where the county where the program is located. This slide gives our PIP responses in English as of yesterday morning. Next slide, please. As I mentioned previously, $8 million was allocated to the CCR&Rs to purchase supplies for currently open, licensed, and registered programs throughout the state. Many creative supply distribution models, such as drive-up pantries, door-to-door deliveries were utilized, providing diapers, baby formulas, wipes, gloves, masks, and cleaning supplies to providers around the state. I would like to highlight what the CCR&Rs, affectionately known as the consortiums, did. As you know, New York City was hit exceptionally hard by the pandemic. The city is shut down, transportation is open and operating, but it is difficult to maneuver throughout the communities. Distribution of supplies and coordination of ordering supplies for the thousands of providers would prove to be extremely difficult. Through a partnership with Kaplan, the consortium set up an online store where providers could select from a predetermined supply list and order up to $600 of supplies for their program. Supplies would be then directly shipped to the provider, leaving the CCR&Rs outside of the delivery mechanism. We're grateful to Kaplan for stepping up and serving the providers in New York City. So if we could take our presentation back to the second slide, I will turn this over to Jamie Frank, who can speak to you about the state's response. And then Jamie will jump ahead, everyone, to Kathy Hallis's slide. So if you go back one more, I think Jamie should be ready to go now.
Hi, this is Jamie. Can you hear me?
We can, Jamie.
Oh, thank goodness. That was so scary. But here I am. So thank you, Meredith, and thank you, everyone, for your patience while I figured out how I can be heard. So I wanted, we'll go back similar to DC about pandemic emergency planning. And so for us at OCFS in our office near Albany, we originally, we got a notice from DOH about travel exclusions and how to make sure that our programs were aware about there's this virus and make sure we should up our hand washing. And so we were doing that in February, but then we were thinking that, okay, how can we be best planned for if this were to hit us really hard, which as Meredith said earlier, it ultimately did in New York. The first decision that we made, and then this goes into some of our data, but we were originally looking at our childcare system in New York State where we have 800,000 licensed and registered childcare spots. We have 2.6 million public school children in the state of New York. And so we were looking at those two figures, trying to handle how, if schools were to close all of a sudden, could our childcare system be able to take care of the additional children, which was a mounting task. And so what we started to do, we processed ultimately about 400 additional waivers from our programs that would, for instance, allow a program that serves only infants, toddlers, and preschool children to amend their license for the sake of the emergency to serve school-age children so they could take the older siblings of the young children in care. and other sort of different licensing things we'd have to try to create additional spaces. Started thinking about satellite spaces. We'll talk more about this in a second, but ultimately that ended up not actually being really needed because the utilization rates were so low of children actually attending care. But when we were planning for the pandemic, we did not know that yet. The next important thing that we did was in New York State, childcare providers and services are classified as an essential service or business, so that they were allowed to remain open during the pandemic. I know different states have done different things. For New York State, we allowed our childcare programs to stay open unless they were directed by a local or state health official to close, which was what would have been the case if there was a confirmed case, for instance, in the setting. I'm going to, if we go to the next slide and then we'll come back. Yeah, we can go to the next slide. Can I do it?
Is this the slide that you would like?
The one I would like to see is it has the pictures of the hand sanitizer. I don't know if that's what that's not what I see. I don't know if other people are seeing that. Oh, perfect. Thank you. We in New York State have worked very hard to try to be responsive to the needs of our providers and our settings, and so at the very beginning, there was a national hand sanitizer shortage. Our governor directed New York State to start making their own hand sanitizer, and so we were able to get that with the help of our CCR&Rs, who did all of the communication, actually supply delivery, to get the hand sanitizer into the hands of our programs that remained open, which really helped, I think, the programs that stayed open to thrive. The couple other actions that New York State took in support of families and providers. I talked about the regulatory flexibility. We've expanded the number of paid absence days, number of paid program closure days, waived the family share for families affected by COVID-19, expand the subsidy eligibility up to 85% of the state median income, and extended the eligibility period for children in care. The next thing that we were able to work on is once we received our federal CARES allocation, New York State, and I know Meredith talked about this in great detail, so I'll be very fast. But New York State received $163.6 million in CARES Act funding for childcare. And so our first phase of that is we have put $30 million out to sort of stabilize our system for essential workers, which included the tuition payments for the essential workers' children and the direct grants to supplies for the program. Now, as we move into phase 2, we have multiple competing needs. And so some of the things we talk about, and we have to plan around, and this is, I'll talk about our data in one second, but I think where our use of our data has been really helpful is some of the things we're thinking about is additional subsidy for families, as well as operating grants for programs, both programs that have remained open, and then restart funds for programs that had to temporarily close. And in regard to the operating grants, they have to think about with the new CDC and safe social distancing guidance and practices, how can we best support them especially in regard to their fiscal viability, which is where we go to our data. And so I think the slides that have the maps on them. So the one before this one is the overall data, I think. No, it's not. Maybe it's after. Okay, it doesn't matter. But so what we did in New York was we've been trying to track all of our programs that have closed temporarily during the emergency. And so what we have found and surprised us is about 60% of our providers have remained open. And there's a little bit of an asterisk on that figure. Actually, there's two. One is that New York City daycare centers are not under the auspices of the state. And so New York City, by local ordinance, closed all of their daycare centers except for those serving essential employees. That's not reflected in this data. New York City family-based programs are under the state auspices. But so outside of the daycare centers in New York City, the majority of our programs remained open, except that there's a significant difference in regard to modality, in that our school-age childcare programs, for the majority, closed. Actually, I think 87% of them closed. Our daycare centers are around the 50%, and then family-based childcare, so home-based care, is actually a much lower percentage. And the majority of them, they stayed open, and that's what you're seeing on the map. Those are the counties of New York State. It's about 17% of their programs remained open. I mean, that closed, so the rest of them are open. We also were then able to, our regulators, our license and registration staff, called and did phone interviews with 13,000 of our childcare providers in New York State. And they were asked, if they are open, if they were closed, if they were open, how many children were in care, and if those that were closed, when do they think they'd be able to reopen, and what is the biggest barrier to opening? And of those that have remained open, the average utilization rate was around 27%, so about 1 in 3. So if you're licensed for 10 kids, there's 3 children in care. 100 kids, there's 30 children in care. Of those that closed, the majority said they did not know when they would reopen. Virtually all of the school-age programs said they'd reopen in September. Of those that responded, 30% said their biggest concern was not having enough children to serve if they reopen. Other top responses included the health and safety of the children, as well as lack of cleaning supplies and access to staff. And so I think those interview data is what we're using to try to think about what we're moving on to our next installment of our CARES funds, is how can we best support our programs. I think similar to DC, I guess this is sort of our version of stage 2, where stage 1 has been those that remained open, and stage 2 is how can we get, start to rebuild under the new social distancing protocols. And I'm going to turn it over to Kathy to talk about how it's been on the ground. And I, again, appreciate everyone's patience with my audio difficulties.
Oh, thanks, Jamie, and good afternoon, everybody. Excuse me, happy to be talking to you today. Kathy Hallis, Executive Director of the Childcare Council of Westchester. Excuse me, and Westchester County is home to almost 1 million people and has the distinction of being one of the early epicenters for the pandemic. And it is a region of great wealth and great poverty and everything in between. We also have about 750 regulated childcare and after-school businesses. And because childcare programs are going to be open throughout, per directive of the governor, we decided that our organization would be open throughout as well, although we have certainly been following CDC guidelines. So at any point in time, 75% of our staff are working from home, but our office, in fact, has been open. And one of the first things we started to do, frankly, and it wasn't particularly methodical, but we just started calling all the childcare programs in our database to find out were they open, were they closed, what was happening, what were their concerns, and we wanted them to know that we would be there with them throughout this, experience. Next slide. So obviously one of the first things, we became aware of is that although there was a lot of information coming out from multiple sources about COVID-19 and how to respond and how to support children and families, we figured that it might be overwhelming, frankly, for programs. So what we decided to do fairly quickly was bring our Director of Healthcare Consultant Services and connect her with the community. She happens to be a family nurse practitioner. She's very experienced. She's got very high standards. She's been, a rock throughout. So she started offering Zoom sessions, weekly Zoom sessions, which we will continue, into perpetuity at this point, where she is answering all kinds of questions, providing resources. It always then generates a lot of individual follow-up on her part with people on the call. There are week to week about 100 different participants, on the calls. She has done some additional Zoom training on infection control that will also be, repeated. And she's constantly sending out information, to programs for them to use, not only for themselves, but also to share with parents. Next slide. So obviously the other concern that we became aware of immediately was the great deal of anxiety felt by programs and concern about their financial viability. I would say early on, fewer than 50% of our programs were open. That open programs has continued to increase somewhat every week, but has always been true that it is a preponderance of home-based businesses that are open. However, many of them have very few children coming. Instead of 12, there may be 3. I visited a center last week that is has been open throughout, is licensed for over 120 children. They have 20 children, in attendance. So we were also being bombarded with all kinds of information about the SBA programs, and our Director of Finance and Admin happens to be an MBA with a specialty in finance. So we put him to work, and he created a Zoom training on those programs and how to access them. And we were lucky to have the services of an area center director, also very skilled in financial management, who was trained by our county Office of Economic Development to provide direct assistance to businesses in applying for the EIDL and the PPP. And so following the Zoom training, which we've done several times, we're also able to link people to somebody who would provide them with the assistance they could actually file, those applications. And we're going to be doing another session, I believe, next week, now that more information has come out about the forgiveness phase of the PPP. We're going to be providing childcare businesses with some specifics, in that regard. Next slide. So if you came to our office in lovely Scarsdale, New York, you would think you had stumbled upon a Walmart or a Costco. We are full of all kinds of supplies. We've been doing food distributions directly to parents through home-based providers. We've been giving out diapers and baby formula and baby food through the generosity and real partnership from a number of community groups, as you might imagine, United Way, also our local food bank, Feeding Westchester. And we have asked staff, regardless of the particulars of their position, to assist in all these, unique activities that we find ourselves doing right now. Next slide. As mentioned before, we too are distributing the CARES Act supplies. That has been a mammoth undertaking, and we are still in the thick of it. We are dropping some of those off directly to particularly home-based programs, but in addition, we have people coming in to pick up. We're doing, we're offering evening hours and Saturday hours as well to make it easier for those childcare programs that are open but don't have a lot of staff to actually come up and and get the materials. And in addition to a lot of consumables, we are providing things like first aid kits and flashlights and smocks and no-touch thermometers. And the response on the part of the program's providers has really been, they are overwhelmingly grateful. Next slide. So we also have been administering the CARES Act scholarships as were described to you earlier. Currently, we have 80 children who are participating. And our local community foundation also contacted us early in March to say that they saw additional investments in childcare as being very integral to the recovery of the area. So we have an additional scholarship program that we're running for them. And we are obviously referring parents to open programs. Our referral activity had really dwindled, but I'm happy to say that this week there is an uptick. Westchester County has just entered into phase 1 of a fairly lengthy reopening process. So we do expect to be working with more parents who are going back to work outside the home, very soon. Next slide. And throughout, we were and we are still in awe of the sacrifice being made by the folks on the ground who have kept their programs open, who have their own concerns about their health and safety, that of their families, but have been there in particular to make it possible for first responders and other essential workers, to do what they need to do. So we actually held a parade. You can go on our Facebook site and actually see a video. It's really, kind of fun. And we asked our county executive to film a thank you specific to the community, which we also circulated. And so we're trying to think of what other kinds of things can we continue to do to really acknowledge, just the tremendous work that our childcare providers are doing. Next slide, please. And of course, we continue to advocate for more childcare funding. We are enormously grateful for the CARES Act. We are hopeful that the HEROES Act will pass. But, we too believe that much more money at the federal level is going to be required. So we are very, very involved in advocating, for those additional dollars. Next slide. So we too have made a shift to providing some training virtually. We're actually offering a conference a week from Saturday, totally virtually, with an emphasis on supporting children's social and emotional well-being. I believe we're going, I'm anxious actually for us to be able to go back out into the field and leave the virtual world. I know that programs are going to need some very specific help in redesigning their spaces to comply with CDC guidance. We're anxious to do that. We are very mindful too of the disruptive, even traumatic experience COVID-19 has been for so many people. And we are preparing all kinds of trainings for the childcare community along those lines. We expect to be much more active in supporting parents and educating parents on what it is they need to see in childcare settings as they return their children to those settings. And we are anxious to collaborate with school districts who at this very moment are planning, their reopening strategies. Next slide. And you know, we have been absolutely in emergency mode since early March, but we are trying to remember some of the things that were important to us pre-COVID-19 and make sure that we don't abandon them. So census work, very, very important. So we are continuing to remind people to, you know, to take part in the census. And we were contacted by a foundation that's been a supporter of ours for a long time to ask what else we needed. And we put together what we call the Joyful Summer Project. And if it's funded, we are going to bring different experiences and materials to 50 childcare programs in Westchester. And the activities would be, you know, fun, like bubbles, the joy of bubbles. And we would assist programs in actually doing that kind of programming outside with mixed age groups that have all the materials. Our specialists will be available for technical assistance, and the children will actually be able to bring some of these things back home so that maybe they can have some fun, child-centered, relaxed kinds of experiences as well. You know, we are, again, very, very concerned about the emotional toll all of this is taking. And so, you know, we need to be thinking of more strategies to address that. I think that concludes my presentation.
Thank you very much to all of the presenters. We actually have a couple of questions, but we do have one quick response from DC, and I wanted to give you the opportunity, DC, to make your announcement.
Okay. Hi, Kiami. This is Dale Brown. I'd like to invite Eva Lagara and Dr. Catherine Pingera to talk about the announcement that was made yesterday by the mayor's office that's in effect tomorrow.
Sure, Eva actually had to step out, so we can just briefly mention that DC has decided to move to phase 1 of reopening effective tomorrow. And so the details around that are being ironed out, but it is the first step in the process of moving towards whatever the new normal will be moving forward.
Thank you so much. And we have a similar question for New York. It says, does New York have a reopening draft guideline yet for child care centers and schools?
We have a draft one, but it has not been fully vetted by our Department of Health and our COVID team. But so we're anxious to get that out as soon as possible.
Thank you. I do want to say we're right at the end, and I know that we have maybe 1 or 2 more questions, and we'll try to get those answered in the chat. But I do want to thank all of our presenters. But most importantly, I want to thank all of you all who attended this session. There were some technical glitches I hear from the chat, and I know that we have recorded this and we will be sharing the playback along with the slides. We invite you to join us to view all of our other COVID-19 related webinars that are posted on our website at childcareaware.org. If you have any specific questions, we have a new emergency child care and technical assistance center. When you go to childcareaware.org, you can, if you need some additional technical assistance, you can go on our site and request TA. If you have any specific questions, we have a email address located right here at the bottom of the screen. Learn more at usa.childcareaware.org, and we will be happy to get back to you. Look for the email with the recording and the slides in a day or 2 in your inbox. We thank you again and hope you have a wonderful rest of the day. Bye-bye.